want to partner with you. Students, if you're ready to get better in basketball, volleyball, tennis, come and check us out. Look at our Instagram. We have a lot of content and we got more coming. We're one of the fastest growing company in the Bay Area, and there's no other place to be. Parents, if you really want to unlock the potential of your student athlete, come and partner with us. Or if you yourself want to come out and get some training with Coach Ryan, don't hesitate. All you have to do is click the link below. Unlock your fullest potential. Be ready. Get up, act today. Let's see.
Hi, everybody. This is Coach Ryan, and as part of our Veterinary Heroes segment, we have another veterinary hero with us, willing to share her insight and expertise with us. Ladies and gentlemen, I bring you registered veterinary technician Savanna Lagomorso. Did I say correct?
Lagomarsino.
Lagomorso. Sorry, I'm so sorry.
It's a lot.
Thank you for joining us today.
Thank you for having me.
Yeah, I'm really excited and that you decided to come on and help spread awareness.
Thank you.
Yeah. So, jumping right in, tell us a little bit about yourself, where your love from, and what inspired your love for animals.
Well, I'm a California girl, been here all my life. We get to see all kinds of animals outdoors in nature, whether you're out in the parks, you're hiking. And from a young age, I've always just had this love for animals. Yeah. So,
Okay.
yeah.
Was there a specific moment or animal that made you realize you wanted to be in veterinary medicine?
So there was a specific moment. When I was younger, maybe 8, 9, 10 years old, I had a pet rabbit. And yeah, she was super cute. And as a kid, your rabbit, your first pet is like your baby. It's everything. She had some ear issues, and we weren't sure what was really going on with her. So we took her down to my family veterinarian. And coolest thing is here I am, this kid, 9, 10 years old, with my rabbit. And the doctor, the veterinarian's like, hey, come here. I want you to check out what I pulled out of her ears. Brought me over to a microscope, brought it down to my level. And for the first time in my life, I got to see ear mites.
Oh,
it was so inspiring. It was so cool. And from that point on, it was just kind of like, I want to do this. I want to do this,
Yeah.
So, yeah.
Oh, that's amazing.
It was really cool. Yeah.
What, if you don't mind sharing, what family vet was that? Do you even remember?
Absolutely. It was, Bay Area girl over here, San Lorenzo vet, Dr. Hall.
Okay.
Yeah. I'm not sure if he's still around, but he was a really cool guy. Yeah.
Yeah. Cool. Let's jump into your role as a RVT. For those who don't know, how would you describe what a registered veterinary technician does?
Sure. So it's a lot. We do everything pretty much from A to Z. We are intaking patients when they come in, getting histories, triaging, anywhere from placing IV catheters, collecting blood to run diagnostic labs on their bloods and other samples. We do diagnostic imaging, x-rays, ultrasound, CT scans, supportive care, placing bandages, splints, surgery, inducing and monitoring anesthesia. We do it all, husbandry stuff. There's a lot involved, filling prescriptions, giving medications. You would be surprised. It's a lot. Yeah.
I call that the heartbeat of the hospital.
Oh, 100%. I like that. Absolutely.
So what's the difference between working in a regular veterinary setting and an emergency veterinary setting?
There's some differences indeed. I think the main one you can really see is going to be with your day practice scheduling versus an emergency. In your day practices, you have scheduled appointments set up. You know what's coming in, you know when it's coming in. Most of the time you have a good rapport with the clients because you've watched their pet kind of go through life stages along the way. Whereas an emergency, you don't know what's going to come through the door, when it's going to come through the door. You don't know anything about the patient most of the time or the client. And you have to be prepared always.
What's a typical day or night shift like for you in the hospital?
Sure. So it could range, right? You can have a day where you might see 5 or 6 patients in a 10 to 12-hour shift,
Yeah.
or it gets pretty crazy and you might see 30 or 40 cases in a 10 to 12-hour shift. So it could vary. You never know what you're going to get. But that's kind of the exciting part of it.
Yeah. Do you have like routines or things like that? I'm going to spill the beans really quickly. She is also a very skilled surgery technician as well. But with all those skill sets, I mean, how do you prepare for your day?
So making sure you have all the supplies and equipment ready to go for any case. Essentially, you want your catheter trays set up and stocked. You want your blood tubes set up and stocked. You want to make sure you know who you're working with and how long they're going to be there, so you have that collaboration with them, teamwork. You want to know your doctor, how they like their flow to go. It just being prepared again for whatever may come through.
Yeah. What's one of the most heartwarming cases you've experienced? And on the flip side, what has been one of the toughest?
That's a tough question because picking just one heartwarming case is kind of tricky. I can say any case that comes in where you're unsure of what the outcome is going to be, when you're putting your blood, sweat, and tears into it, when you're collaborating with your team, your doctor, other departments even, to get a patient through whatever they're going through. And when they make it and they walk out of the door to be reunited with their family, that is always heartwarming. It is. And then on the flip side, of course, picking a tough case is also difficult. I've seen a lot of things. But again, when you're putting all your efforts in, you're putting all your cards out on the table, pulling everything out you can to help a patient through what they're going through, and they don't make it, that's the hardest part of it. It's tough. Yeah.
Yeah, I agree with that. I think this happened to me the other day, and it made me think about this question. When pets get so anxious and you take them out for a walk, and then they go back to the room that their parents left them in, that always, oh my God, they don't go.
Where'd they go?
Yeah, they're like, oh, that is the worst. It makes me think.
No.
I know. I feel so sad for them too. I'm like, oh, let's go on a walk, little bud. And then they go right back to that room that their parents left them in. Like, oh.
Yes. Or they go straight for the exit door, like, wait, it's time to go. I want to go home.
Yeah.
Yes.
Oh, I couldn't imagine.
Aww.
How do you stay emotionally grounded while dealing with emergencies, life or death situations, and pet loss?
So during an emergency situation, trying to stay grounded is extremely important. The way I try to do it, and what seems to work for me, is I try to keep myself as calm as possible. I breathe. I try to stay focused with that calm. I might be screaming on the inside. My heart might be jumping out of my chest, but I need to display the calm. Not only for my colleagues, but for the clients as well. I think having that calm sense helps everybody get through a crisis, however it may end. And then, of course, after everything's settled, just kind of talking about it with colleagues, like, oh, how are you doing, checking in, making sure everyone's doing okay.
Yeah, yeah,
Yeah.
yeah. You are one of the most positive people I've ever worked with.
Oh,
And it's
thanks.
so refreshing to have that spirit come into the door because it makes you feel like you can conquer anything.
Absolutely. Oh, thanks, Ryan.
Um, what are some surprising things people don't realize you have to know or do as a vet tech?
So a lot of people, they don't realize that our little vet tech minds hold a lot of information, not
Yeah.
only about cats and dogs, but we've got to know, everything from goats to horses to reptiles to pocket pets, birds, even goldfish.
Hmm.
Um, so there's a lot of information that we need to retain and be able to articulate back to clients when we're trying to share client education with them about their
Hmm.
pets.
Hmm.
Um, and I think it's just one thing that people don't realize, that there's so much involved in our job.
Yeah. Yeah.
Yeah.
How important is teamwork and communication between techs, veterinarians, and pet parents during a crisis?
Um, it is extremely important to be able to communicate between your doctor, between
Hmm.
your colleagues, and especially the clients. When there is a crisis, we need to have clear communication on who's doing what. If we're giving medications, how much are we giving? What route are we giving it? Who's grabbing, ET tubes to intubate? Who's placing a catheter? Does the
Hmm.
client understand what's happening? Do they want to pursue, the treatment plan or not?
Hmm.
Um, Communication is key in this field. So you really get to fine tune your emotional intelligence when communicating with everyone, because
Yeah.
everyone has a different communication level.
Mm.
So
Mm.
it's so important to just understand and be able to articulate things,
Yeah.
for sure,
Yeah.
especially in crisis.
Yeah. Yeah. What's one big misconception people have about what you do?
Um, I think the biggest one for me is, oh, you get to play with puppies and kittens all day. It was fun. And
Yeah.
I'm just like, yeah, let me
Right.
tell you about my little parvo puppy. I got to
Right.
be all day with hemorrhagic diarrhea. And,
Right.
he was so weak. He didn't want to play with me,
Mm-mm.
or the upper respiratory kittens. And I mean, yeah, there's days where you do get to see them, but it's not common when
Yeah.
they're wanting to play. I mean, these are sick, critical patients that we are trying to get back on track.
Yeah.
So, yeah,
Yeah. Yeah.
yeah,
You're not alone in that.
yeah.
What does it take to become a registered veterinary technician, and any advice for someone interested in this path?
Right. So to become a registered veterinary technician, it takes passion and courage. I think those are the two keywords I'm going to throw out there.
Okay.
You've got to love what you do. You've got to be strong in some tough situations and follow through with it. Um, and advice is, stay humble, right?
Mhm.
When you first start out, don't expect to be jumping in and doing all the fun, exciting surgeries or placing catheters right off the bat. You kind of have to work your way up, stay humble. Again, it's an evolving career. You're constantly learning new things. Medicine is changing, new technology is coming out, new diseases are here and there. I mean, look, we've got this bird flu outbreak going on.
Mm.
It's constant knowledge and just keeping yourself up to speed with it. You've got to go to school, you've got to take boards, you've got to pay for your license and your continued education. There's a lot involved, so you really need to be passionate about it.
Yeah. Why do you believe your role is crucial, not just for animals, but for their families as well?
I feel that as an RVT, our role is meant to really bridge the gap for pet parents and pets, for them to really understand what's going on with their pet, and how to move forward with whatever's going on with their pet. We're here to help educate and advocate. And I think it's important because, our doctors are amazing. They're superstars, but they've got so much on their plates. We kind of take that extra burden off of them to really communicate the next steps, the home care, discharge instructions, everything for their pets, and just making sure they understand it.
Yeah, I love that. Where do you see yourself going next in your career? Any dreams, goals?
I love what I do right now. I'm actually really content where I'm at.
Okay.
I imagine somewhere in the future, my body's gonna get a little tired. So
Mm-hmm.
maybe I'll go back to teaching, instructing our future RVT students. I really
Yeah.
do enjoy building people up and
Yeah.
helping people develop their skills.
That is so true about you. I really admire that about your personality and attitude and heart. Yeah. Um, what do you what do you enjoy doing outside of work when you're not saving lives?
I'm an outdoorsy kind of girl. I love to go
Okay.
hiking, take the
Yeah.
dogs to Yosemite, nature
Hmm.
watch.
Yeah.
Right now, I've got this amazing garden going on in my backyard. Springtime's
Oh.
my favorite season. Flowers
Yeah.
are blooming, birds are coming through. I
Yes.
just love the outdoors, this fresh air. Get
Yeah.
out of the
Yeah.
little city. Yeah.
Hmm. What is one thing you wish everyone knew about emergency veterinary technicians?
We are human.
Mhm.
We have emotions. We want to be perfect despite every effort to be perfect. We are perfectly imperfect.
Mm.
But we care so much. We want the best for your pets. We really do. And that's what we're here for. We're here to help. And every single pet that walks through the door leaves an impression on our hearts forever. I mean, every single one, because we do become attached and we really do care.
Yeah.
Yeah,
Thank you for that, Savannah.
absolutely. Thank you, Ryan.
Well, thank you for taking time and just helping educate the world and spread awareness about how important a registered veterinary technician is, not just to the animals, but to their families as well.
Thanks. My pleasure being here. Thanks for having me.
Of course, ladies and gentlemen, if you have a crisis, this is a shining example of what you'll be dealing with, and make sure you treat your veterinary hospital the right way. Treat their nurses with all the respect and care, because all they do is care and lead with their heart. This is Coach Ryan, Athletic Conceptual Training. We're out.
Hey guys, this is Ryan from Athletic Conceptual Training. We're serving the Livermore area and we really want to partner with you. Students, if you're ready to get better in basketball, volleyball, tennis, come and check us out. Look at our Instagram. We have a lot of content and we got more coming. We're one of the fastest growing company in the Bay Area and there's no other place to be. Parents, if you really want to unlock the potential of your student athlete, come and partner with us. Or if you yourself want to come out and get some training with Coach Ryan, don't hesitate. All you have to do is click the link below. Unlock your fullest potential. Be ready. Get up, act today. Let's see you soon.